Have you heard about this Abu Dhabi Wound Care conference? It's coming up in April 2025.
Yeah, the 16th one, right?
Yeah, and it's all about how wound care is getting, well, pretty high tech.
Really interesting stuff, yeah.
And the theme is all about evidence made personal. So basically, it's about how treatment is becoming more personalized.
Like tailored,
Yeah.
specific to each patient and their wound.
Exactly. So in this deep dive, we're going to explore how technology is changing wound care and what this whole personalized approach actually means.
It's a pretty big shift from the old way of doing things, where it was kind of a one-size-fits-all approach to wound care.
Right, like everyone got the same treatment no matter what.
Exactly. And it makes sense if you think about it. Like, you wouldn't expect to buy a suit off the rack and have it fit perfectly right
No
now.
way. You'd need alterations.
Exactly. So why should wound care be any different? Each wound, each person is unique.
So how are they actually making wound care more personalized? What's an example of that?
Well, for one, they can now take a really deep dive into what's causing the wound to hang around, especially those chronic ones that are so stubborn.
Yeah, those are tricky.
Right. So now, with better diagnostic tools, doctors can figure out if it's an underlying condition, maybe an infection, even something like diet that's slowing things down.
Oh, wow. I didn't realize diet could play such a big role.
Oh, it can, definitely. And once they pinpoint the culprit, they can create a treatment plan that's truly tailored to that specific patient.
That's really cool. And speaking of high-tech stuff, what about these advanced wound dressings? Are they as sci-fi as they sound?
Some of them are pretty wild, yeah. There's this one that uses negative pressure wound therapy.
Negative pressure.
Yeah, it's basically like a tiny vacuum that they seal over the wound.
What?
Yeah. It sounds strange, but it helps draw out fluid and actually encourages new tissue to grow.
That is wild. But honestly, it sounds expensive. Can everyone access these
Yeah.
kinds of technologies?
That's a huge question. Accessibility is a major concern, especially in areas where resources are limited. Cost is definitely a barrier, yeah. And that's something that they're trying to address more and more in the field, making sure these advancements are available to everyone.
Good. I'm glad they're thinking about that. And you mentioned telemedicine earlier, right?
Right. Yeah.
So how does that play into personalized care, especially with wounds?
Well, think about someone who lives, say, in a rural community far from specialists.
Yeah, there's not always a wound care clinic on every corner.
Right. Telemedicine lets them have a virtual appointment, send pictures of their wound to the doctor.
So the doctor can see what's going on.
Exactly. And the doctor can give advice, make adjustments to the treatment plan, all remotely. It's pretty incredible. And some platforms even use AI now. They can actually analyze the wound images and help the doctor track how things are progressing.
Wow, so AI is even entering wound care now.
It is. It's becoming more and more common.
So is this the future of wound care then? Just high-tech gadgets and AI?
Well, technology is definitely playing a bigger role, but it's not just about the gadgets. It's how we use them.
Okay, I see what you mean.
Right. It's about remembering that there's a person behind every wound, So all this fancy tech has to serve that person and their needs.
So it's not replacing the human element, it's more like enhancing it.
Exactly. It's about empowering patients, making them a partner in their own care.
So how does that work in practice? What does that look like?
Well, it starts with good communication. The doctor explains everything clearly, involves the patient in making decisions about their treatment.
So it's not just, here's what you're getting.
Right. And it's also about understanding the patient's concerns. Like, some people are very anxious about their wounds, and doctors can offer extra support or counseling to help with that.
So it's really about the whole person, not just the wound itself.
Exactly.
Yeah.
And that's something they really emphasize at this Abu Dhabi conference.
And this conference, it's bringing together researchers and doctors from all over, right?
Yeah, it's a global effort.
So how do they make sure that all the amazing research they're doing actually makes its way into real-life clinics?
That's a big focus of the conference. They have sessions where researchers present their findings and clinicians can learn about the latest breakthroughs. Plus, they have workshops to help translate the research into practical guidelines that doctors can actually use.
So it's not just a bunch of scientists talking amongst themselves.
Nope. It's all about bridging the gap between research and practice.
That's great. So what kind of cool stuff can doctors learn about at this conference?
Oh, all sorts of things. There's a session on using 3D printing to create custom wound coverings, for example.
Custom wound coverings.
Yeah, so they can perfectly match the shape of the wound and the patient's body. It's super high tech and really personalized.
That's amazing. It sounds like the future of wound care is, well, pretty bright.
It really is. There's a lot to be excited about.
Definitely. And it's inspiring to see this kind of global collaboration. everyone working together to improve wound care.
It is. It shows how committed people are to, to finding better ways to heal and help people.
It makes you wonder what they'll come up with next, right?
Yeah.
What other breakthroughs are on the horizon?
I know. It's incredible to think about. Maybe someday wounds will be like a thing of the past.
So it's a nice thought.
It is. And even if we don't completely eliminate wounds, the future holds a lot of promise for faster healing, less pain, and a better quality of life for so many people.
Couldn't agree more.
It's an exciting time to be in this field, that's for sure.
Absolutely. And that's it for our deep dive today. Thanks for joining us.
Thanks for having me. It was great to talk about all this. And, it makes you think. With all this progress, what ethical considerations might come up in the future? Things we haven't even thought of yet.
That's a great question to ponder.
It is.
Something to keep in mind as wound care keeps evolving. Thanks again.
You're welcome.